Hi, my name is Kirk Hamilton. I'm a practicing physician assistant of more than 30 years in nutrition, prevention, integrative medicine, author, health educator, and host of this show, the Staying Healthy Today Show. Today's show topic is heart disease is preventable and reversible. I just came back from the Nutrition and Medicine Conference in Washington, D.C., entitled Cardiovascular Disease, put on by Physicians Committee for Responsible Medicine, PCRM.org, and it was outstanding. And I just want to give you some highlights. And obviously from the title I just said, the point is that with a plant-based diet, a whole food plant-based diet, heart disease is preventable and reversible. But I want to kind of go through the highlights for me. The first day started off with, heart disease starts when we're young. In fact, one researcher from Australia documented heart disease lesions starting in utero. Okay, and then there was the review of the Bogalusa heart study from Louisiana by Dr. Berenson, started in 1972, which actually started documenting lesions in children in the Louisiana community at 5 to 8 years of age. But they have developed a program to help look for those risk factors and help intervene, and then followed those people for many years. And it's very important to arrest and to jump on heart disease early so it doesn't create more serious heart disease later on in life. And then staying on that theme of young children, Dr. Mackinnon from the Cleveland Clinic took a group of children who were obese and high levels of cholesterol and put them on a plant-based diet with their parent. One parent had to do it. And the point was that, number one, there was reductions in cholesterol and certain other risk factors, but would children do that? And it had to be with a parent. So that was a very positive thing. Then there were some other more interesting things that you wouldn't think of. For example, a doctor from Helsinki, Finland, showed that blood flow to the blood vessels in the back, starting from some of the larger arteries in the aortic area, but the blood flow and atherosclerosis in those lesions could lead to back pain and disc problems. So the next time you have back pain, don't just think about getting an adjustment maybe or a massage, but think about how's your blood flow doing. So then from there, one of my favorite parts of this conference was where the rubber meets the road. They had one internist and 3 cardiologists speak on how they implement a plant-based diet, the type of diet that's shown to reverse and prevent heart disease in a busy medical setting. And one was actually the son of John McDougall, Craig McDougall, who was formerly at Kaiser, developed a program where they incorporated plant-based diets to help with cardiac rehab and wellness. And interestingly enough, I've run into 2 people who had bypass surgeries who were both at Kaiser, who were in those programs using Dr. Esselstyn's book, Prevent and Reverse Heart Disease. So then, where it means something to me, I'm a clinician, so taking studies, but if you can't apply it in the real world, there was 3 cardiologists there, one from Houston, Texas, one from Detroit, Michigan, one from the Bronx, and all very busy cardiologists applying plant-based nutrition to all people from all walks of life, not just wealthy people, but poor people, and having success in applying a plant-based diet in those busy practices. And then we heard Dr. Caldwell Esselstyn speak, who was kind of the keynote speaker who wrote, again, this book, Prevent and Reverse Heart Disease, and did landmark studies, starting one in 1985 with 22 people with very bad heart disease, and showed that those who stayed with the program could have reduced events and actually some reversed their disease. And then he had the updated study in the Journal of Family Practice in 2014 where 177 people completed this study, and in those that stayed with this program over 3.7 years, these are the people who had heart disease, they had 0.6% recurrence of some event. Those who went off the program had a 62% recurrence of some cardiac event. So it was good to see him explain his dietary program of the 4 food groups, and it's very simple. It's whole plant food, unprocessed, legumes and beans, fruits, vegetables, and whole grains. Doesn't add oil, very little nuts and seeds, maybe a little ground flaxseed. So that was Dr. Esselstyn. And then the other part that was kind of like icing on the cake for me was hearing Dr. Kim Williams, who is the president of the largest, I guess, most prestigious body of cardiologists, the American College of Cardiology, speak about plant-based nutrition. He's a plant-based guy himself. So this is really getting in the mainstream. And then another very powerful talk for me was Dr. Kolpecki from the Mayo Clinic, the Mayo Clinic, who talked about erectile dysfunction, a very common problem, and the earlier it occurs, the more likely it's related to coronary artery disease, and it's an early marker risk factor. So aside from thinking about, yes, testosterone levels are low, but aside from going to testosterone right away, you want to maximize your cardiovascular health, and a plant-based diet is the way to do that. So this was powerful. There was also a talk on inflammatory markers for vascular disease, which we do here from the Cleveland Heart Lab. So here's the bottom line. The bottom line is heart disease is the #1 killer on the planet. If we can wipe this one out, wipe out heart disease by a simple tool, a plant-based diet that doesn't cost anything, all the other chronic diseases, many are going to go away, and we're going to help our healthcare system dramatically and save billions of dollars and increase our work productivity. And the other thing we're going to do that was an underlying theme is we have to find a dietary pattern that reverses the chronic diseases, heart disease, type 2 diabetes, obesity, high blood pressure, which are 80% of our enormous healthcare budget, and a pattern that doesn't destroy the environment. High meat-based diets are very hard on the environment. Water, land usage, deforestation, etc. A plant-based diet can do this. So it's a win-win all around. So what I'd like you to do is I have links below to Dr. Esselstyn's articles, his book. I have links in the description below this YouTube to pcrm.org. They're the people that put on this conference on how to get started on a plant-based diet. So go to their website, excellent group. As usual, you can sign up for my health letter with the link below and do my course, my Healthy Living for Busy People course. So until next time, stay and be well. And remember, if you have a loved one or yourself that has heart disease, this is a preventable and reversible condition with a very low risk approach and a very low cost approach. So share it, okay? I'll talk to you soon. You have a fabulous day.